Today is the day 128 of 365 days project and I am here to say about stroke. What is a stroke? A stroke occurs when a blood vessel in the brain ruptures and bleeds, or when there is a blockage in the blood supply to the brain. The rupture or the blockage prevents the blood and oxygen from reaching the brain's tissue. According to the Center for Disease Control and Prevention, stroke is the fifth leading trusted source cause of death in United States. Every year, more than 75 people die in this stroke. Without oxygen, brain cells and tissue become damaged and begin to die within minutes. Let's see the symptoms. Stroke symptoms. The loss of blood flow to the brain damages tissues with the brain. Symptoms of stroke show up in the body parts controlled by damaged area of the brain. The sooner a person having a stroke gets scared, the better their outcome is likely to be. For this reason, it's helpful to know the signs of stroke that can act quickly. It also includes paralysis, numbness or weakness in the arm, face and leg, especially on the one side of the body, trouble speaking or understanding speech, confusion, slurring speech, vision problems, trouble walking, loss of balance or coordination, dizziness, and severe sudden headache with unknown cause. A stroke requires immediate medical attention. If you think or someone else is having stroke, you should call 108 right away. Prompt treatment is the key to prevent the following outcomes, which is brain damage, long-term disability, and death. Let's see the symptoms, particularly in women. Stroke is the fourth trusted source for cause of death in women. Women have a higher lifetime of risk than men in stroke conditions. While some stroke signs are same in women and men, while some are more common only in women, which includes nausea or vomiting, hallucination, pain, general weakness, shortness of breath or trouble breathing, fainting, seizures, confusion, disorientation or lack of responsiveness, and sudden behavioral changes. Let's see what are the symptoms of stroke in men. Stroke is the fifth trusted source cause of death in men. They are also having more common symptoms with women, but particularly drooping on one side of the face or uneven smile, slurred speech, difficult speaking, trouble in understanding other speech, arm weakness or muscle weakness on the one side of the body. Let's see the types of stroke. Stroke fall in three main categories: transient ischemic attack TIA, ischemic stroke, hemorrhagic stroke. Ischemic stroke. Let's see. During ischemic stroke, the arteries supplying the blood to the brain narrow or become blocked. These blockages are caused by the blood clots or blood flow that's severely reduced. They can also caused by pieces of plaque due to the arteriosclerosis breaking off and blocking of a blood vessel. The two most common of ischemic stroke are thrombotic and embolic. Let's see embolic. An embolic is one of the two types of ischemic stroke. It occurs when a blood clot forms in another part of the body, often the heart or the arteries in the upper chest and the neck, and moves through the bloodstream to the brain. The clot gets stuck in the brain arteries where it stops the flow of blood and causes stroke. An embolic stroke may be a result of a heart condition, atrial fibrillation, a common type of irregular heartbeat, which leads to stroke in brain. Transient ischemic attack TIA. A transient ischemic attack are often called as TIA or mini stroke when the blood supply to the brain is blocked temporarily. Symptoms which are similar to the full stroke are typically temporary and disappear within a few hours or minutes. Hemorrhagic stroke. A hemorrhagic stroke occurs when an artery in the brain breaks up or leaks the blood. The blood from that artery creates an excess pressure in the skull and swells the brain, damaging the brain cells and tissues.